Hello everybody, my name is Ryan Averett. I'm a licensed clinical social worker and a mental health therapist, and today I wanted to make a quick video, sort of in response to two guys that came out a couple days ago and started making a bunch of claims about Tylenol and autism. One of these guys has absolutely no experience working in the field of healthcare, and the other one has only been working in the field of healthcare for about 9 months. Unfortunately, these claims are untrue, and I want to talk about them. So first, let's look at the people making the claims.
First, effective immediately, the FDA will be notifying physicians that the use of well, let's see how we say that. Acetaminophen. Is that okay? Which is basically commonly known as Tylenol during pregnancy, can be associated with a very increased risk of autism. So taking Tylenol is not good. All right, I'll say it. It's not good.
So that is the first guy.
The FDA is responding to clinical and laboratory studies that suggest a potential association between acetaminophen use during pregnancy and adverse neurodevelopmental outcomes, including later diagnosis for ADHD and autism. Scientists have proposed biological mechanisms linking prenatal acetaminophen exposure to altered brain development.
And that is the second guy. So, the claim here is that acetaminophen, or Tylenol, is in some way linked to autism. That people who take acetaminophen, or Tylenol, while pregnant leads to an increased risk in the prevalence of autism. So that is the claim we're talking about today. In short, the answer is no, Tylenol does not cause autism. So we'll talk about what is Tylenol, we'll talk about what is autism, what are the causes of autism, and why we can't say Tylenol causes autism. First of all, what is Tylenol? Tylenol is the brand name for acetaminophen, one of the most widely used medications for reducing fever and relieving pain. Its common use is that it's given to children and adults for things like headaches, colds, muscle aches, and fevers. And when used at recommended doses, it's considered safe and has been in widespread use for decades. The biggest real risk is liver damage if someone starts taking too much Tylenol. But this is the drug we're talking about. Next, what is autism? Autism is actually called autism spectrum disorder, or ASD, and it is a neurodevelopmental condition. It's not a disease that you can quote-unquote catch. It affects how people communicate, interact, and process the world. If we go to the DSM-5, we can look at the actual definition of autism spectrum disorder, and I'm not going to read through every single bit of this. The major criteria are persistent deficits in social communication and social interaction across multiple contexts as manifested by the following, currently or by history. And then it talks about deficits in social emotional reciprocity, deficits in nonverbal communicative behaviors, deficits in developing, maintaining, and understanding relationships. Also, it includes restricted repetitive patterns of behavior, interest, or activities, and this can look like stereotyped or repetitive motor movements, insistence on sameness, inflexible adherence to routines, or ritualized patterns of verbal or nonverbal behavior, highly restricted or fixated interests that are abnormal in intensity or focus, or hyper or hypo activity to sensory input, or unusual interest in sensory aspects of the environment. And there's more criteria here, but those are the main criteria. This is how we define autism spectrum disorder. With autism, the symptoms vary widely. Some people with autism may have major support needs while others can live independently. About 1 in 36 children in the US are diagnosed with autism today, and this is because awareness and diagnostic practices have improved. It's important to note that autism is not caused by a single factor. It is complex and rooted in brain development that starts before birth. What causes autism? So there's a lot we do know and there's a lot we don't know. One thing that we do know is that the strongest evidence point to genetics. So autism tends to run in families, and scientists have identified hundreds of genes that contribute to risk of autism. We also know that brain development is a contributing factor, so differences in brain connectivity and early development play a role. We also know that environmental contributions exist, so factors during pregnancy like maternal age, certain complications, or exposure to specific toxins may contribute, but none explain most cases. What doesn't cause autism? There's decades of research to show that there's no link between vaccines, Tylenol, parenting style, or things like eating habits that contribute to autism. So why can't we say that Tylenol causes autism? So first, we have to identify the difference between correlation and causation. So there are some studies that have found that mothers who use Tylenol during pregnancy were more likely to have children later diagnosed with autism. But that does not mean that Tylenol caused autism. Pregnant people often take Tylenol because they're sick, have fevers, or are in pain, and those underlying conditions could be the real factor that contribute to the development of autism. Also, we have to identify the evidence quality. So the research suggesting a connection is inconsistent and mostly observational, meaning that it looks at associations, not direct causes. Large, carefully controlled studies studies have not found strong evidence that Tylenol causes autism. Major health organizations such as the FDA, CDC, and American Academy of Pediatrics do not recognize Tylenol as a cause of autism. And there is a real danger here. Claims from figures like RFK Jr. and Trump are misleading, contribute to fear, and can discourage parents from safely treating fevers or pain, which itself can be harmful during pregnancy. And just to drive home the point of how clueless this administration is about autism, we'll listen to RFK Jr. Make more bizarre claims about it. So here is a handful of terribly misleading claims about autism.
These are kids who will never pay taxes. They'll never hold a job. They'll never play baseball. They'll never write a poem. They'll never go out on a date. Many of them will never use a toilet unassisted.
Yeah, okay. So this is absolutely bizarre. Plenty of people with autism hold jobs, go on dates, do not have to be assisted using the toilet. This is absolutely bizarre claims by this bizarre man, and nobody should be listening to this man. That is kind of the main point of this video. Do not listen to this bizarre man, because this bizarre man is wrong. That is about all I had to say on this topic. If anybody enjoyed this video, please leave a like. If you have any comments, leave a comment. Thank you for watching. I appreciate you very much. Have a great rest of your day, and take care.
Mr. Kennedy, there's no way that you're this fucking stupid.
I am this fucking stupid. The Tylenol causes autism.
Speaks for all of us.
The worm showed me. It was the worm. The worm told me. It's the worm. The worm commands me.